Motofen is a medication that is used to treat diarrhea by decreasing the number and frequency of bowel movements. It works by slowing down the movement of the intestines. It contains a combination of difenoxin, which is similar to opioid pain relievers but acts mainly to slow the gut, and atropine, which belongs to a class of drugs known as anticholinergics. These help to dry up body fluids and also slow gut movement. It's important to note that Motofen should not be used to treat diarrhea caused by certain types of infection, such as difficile-associated diarrhea following antibiotic therapy. This medication is not recommended for use in children younger than 2 years due to an increased risk of very serious side effects. The recommended dosage and timing for Motofen should be discussed with your doctor. When taking Motofen, it's important to follow your doctor's instructions. Typically, it's taken by mouth after each loose stool, or every 3 or 4 hours as needed. The dosage will depend on your medical condition and how you respond to the treatment. For adults, the maximum daily dosage is 8 mg of difenoxin. If your diarrhea is under control and you need to continue treatment, your doctor may advise you to lower your dosage. It's crucial to drink enough fluids and electrolytes to prevent dehydration, especially if you experience extreme thirst, decreased urination, muscle cramps, weakness, or fainting. Your doctor may also recommend switching to a bland diet to reduce irritation to your stomach and intestines. If you suddenly stop using Motofen, you may experience withdrawal symptoms such as stomach cramps, nausea, and vomiting. To avoid this, your doctor may gradually decrease your dosage. If you've been using this medication for a long time or in high doses, you're more likely to experience withdrawal. If your condition doesn't improve after 2 days, be sure to inform your doctor. Some common side effects of taking Motofen include drowsiness, dizziness, headache, tiredness, blurred vision, dry mouth, and loss of appetite. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. It's important to remember that Motofen has been prescribed to you because your doctor has determined that the benefit to you outweighs the risk of potential side effects. Many people who use this medication do not experience serious side effects. If you experience any serious side effects such as stomach or abdominal pain, severe nausea, vomiting, mental or mood changes, restlessness, or numbness/tingling of the arms or legs, it's important to notify your doctor immediately. Seek medical help right away if you experience very serious side effects such as eye pain, swelling, redness, or vision changes. While a serious allergic reaction to Motofen is rare, it's important to seek immediate medical help if you notice any symptoms such as rash, itching/swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects that are not listed, it's important to contact your doctor or pharmacist. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Motofen, it's important to let your doctor or pharmacist know if you are allergic to difenoxin, atropine, hyoscyamine, or any other allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions, so it's essential to discuss this with your pharmacist. It's also crucial to inform your doctor or pharmacist about your medical history, especially if you have liver disease, dehydration, mineral imbalance, ulcerative colitis, or a personal or family history of glaucoma. Motofen may cause dizziness or drowsiness, and consuming alcohol or marijuana can intensify these effects. It's important to avoid driving, using machinery, or any activities that require alertness until you can do them safely. Limiting alcoholic beverages is also recommended, and it's essential to talk to your doctor if you are using marijuana. If you are planning to have surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Children, especially those with Down syndrome, may be more sensitive to the side effects of this medication. It's crucial to ensure that children do not take too much of this medication, as it can have serious, possibly fatal effects. During pregnancy, Motofen should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. This medication also passes into breast milk, so it's essential to consult your doctor before breastfeeding. Drug interactions can affect how your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. Some products that may interact with Motofen include ambinonium, MAO inhibitors, naltrexone, potassium tablets/capsules, and pramlintide. It's crucial to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Be sure to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. If you have any concerns, ask your pharmacist about using those products safely. Remember to always follow your doctor's advice when taking Motofen. If someone has taken too much Motofen and is experiencing serious symptoms like passing out or having trouble breathing, it's important to seek immediate medical help. In the US, you can call the local poison control center at 1-800-222-1222. In Canada, residents can contact their provincial poison control center. Symptoms of an overdose may include severe drowsiness, muscle weakness, fast heartbeat, high fever, unusually fast/slow/irregular breathing, seizures, and loss of consciousness. Sharing Motofen with others is against the law, so it's important to only use this medication as prescribed by your doctor. It is not safe to share this medication with anyone else. If you forget to take a dose of Motofen, take it as soon as you remember. But if it's almost time for your next dose, just skip the missed one and take the next dose at the usual time. Don't take a double dose to make up for the missed one. It's important to store Motofen at room temperature, away from light and moisture. Be sure to keep it out of the bathroom and away from children and pets. When it comes time to discard any expired or unneeded medication, it's best to consult your pharmacist or local waste disposal company. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.